Hello, my name is Amy Mendonça. Welcome to the Culturally Competent Nurse, Addressing Bias and Diversity. This is your Module 7, part of Holistic Nursing and Health at Governor's University. So, a little bit about me. You may be thinking, why is this middle-aged white woman going to be talking to me about cultural competency? What does she know about diversity? Well, the truth of the matter is, diversity is a journey, diversity understanding, cultural competence in nursing. None of us ever arrive there. It's always a journey and a path that we're on. This is based on a very famous and well thought out model of cultural competency in education by Josefa Campina Bacote. And much of what you're learning is based upon her model. And she's the one that said, cultural competency is a journey. We all come from our own background, and we see the world differently. So learning to reach out and give care to our patients in a culturally competent way is a path that we're on. It's not something any of us ever get perfect at. But why is this important to me? That's really the important question. And the truth of the matter is I've been on a journey to cultural competence since I was a very young girl. Started in college. I think I grew up in a very small town. My first college roommate was an exchange student from Taiwan. Very limited communication. Absolute culture shock for the two of us. But I was fascinated by her, and I was fascinated by our relationship and how we learned to get along and how our two cultures learned to mix. Shortly after I finished my first degree, I became an exchange student. I lived and studied in French-speaking West Africa. I lived with a Muslim family. Sometimes I would go days where I was the only white person I saw. So I had an experience that dramatically changed the trajectory of my life. From that point on, I found myself having what is called in Campina Bacote's theory as this thirst for cultural knowledge, this cultural drive, this desire to know more and to be closer to people of other cultures. Fast forward a couple of decades, I met my husband, who is a Brazilian immigrant. He came to this country speaking no English. I now have family in 4 different continents in the United States. And so, as you can see, personally, this topic is very important to me. I'm not perfect. I will make some mistakes. We all will as we try to reach across these cultural and language barriers. But the important thing is, this is a necessary thing to address with your nursing career, because as you will see in the next few slides, this is not something we can ignore. This is something we have to tackle head on and do our very best to be as culturally competent as possible, address our bias and our diversity. So with that little introduction, let's move on. And this will probably be the only time in the whole teaching that I will read from the PowerPoint. So the goals for this module, these come from your course objectives. We're going to examine how our various personal identities, such as race, gender, and culture, influences our perception of ourselves, and how that may influence our provision of nursing care. And I would probably edit that to say it will influence our provision of nursing care. So basically, we got to know who we are so that we can take care of other people. Our second goal for this module, we need to be able to plan holistic nursing care. This whole class is about holistic nursing. So we need to be able to plan that care based upon an understanding of that person's specific identity. And this is all about mitigating disparities that can be attributed to diversity. We want to be able to reflect on our own personal cultural identity and biases to better take care of diverse populations. We cannot eliminate our own biases, but if we know about them, we can proceed forward carefully to let them influence us in the smallest way possible. And finally, we want to be able to identify these health disparities, because at the end of the day, this is what's important, is the health outcomes for our patients. So if there's something that's happening to create a disparity there, simply because of someone's diverse condition, whether it may be their race, their gender identity, their language barrier, those are things that we need to identify. So why does it matter? Why does diversity and culture matter in healthcare? We're all human beings. We all bleed red. We've heard things like this. And a lot of people will focus in on this and say, well, the reason that treating people with attention to their diverse culture is because it gives them a better experience. Absolutely true. If you feel like someone's addressing you with who you are and taking a certain amount of care to treat you with respect to however you identify yourself, absolutely that's going to improve your satisfaction and therefore our patient satisfaction scores, which are super important. You don't maybe know that yet as undergrads, but you will when you get into the healthcare world. However, it is not just about the patient experience. That is an important part of value-based care. We want to make sure our patients feel cared for, feel respected, feel connected. But the most important thing is, if we fail to address disparities, we are overlooking things that can cause our patient harm. So let that sink in a minute. We don't address the disparities, our patients can come to harm. It's the opposite of our goal as nurses. So we're going to learn, just scratch the surface. It's a journey, remember. We're going to learn today to try to identify these disparities so that we can treat people according to their culture, and culture is broad, and we can address those disparities that might be affecting them because of their culture. So, diversity in the patient population. FYI, the United States, the diversity of the patient population is growing exponentially. Very soon, Caucasian people will not be the majority race in our country. Immigration, intermarriage, newer realizations and more openness about gender identity and sexual identity. Those things have changed our patient population. And unfortunately, our nursing diversity has not kept pace. So what's the solution? Obviously, training a whole new happen quickly. First of all, a lot of the diverse populations have difficult access to education, which is affecting the diversity of our nursing population. Second of all, that's a slow approach, and it doesn't address all of us nurses who are already in practice. So the solution is we have to watch out for ourselves, and we have to check ourselves, and we have to be better. It's a short video.
Are you seriously considering her as a candidate?
Just don't trust her.
She's a woman.
She's a woman.
This is a man's job.
She's clearly not educated.
Really? Does she even speak English?
That's not me. I'm not like that. You call it an honest mistake. Science calls it a blind spot. Our unconscious mind is a mysterious and powerful thing. It makes 90% of our decisions without us even knowing it. Our brains are overloaded with 11 million pieces of information every second. Yet we can only process about 40 of them. So we're wired to make cognitive shortcuts, using past experiences to make assumptions. And you know what happens when we assume. Our unconscious mind can put us on autopilot, determining where we sit, who we eat lunch with, who we turn to for advice, and who we choose to offer a helping hand. Living our lives with blind spots can put us in a tunnel. Same point of view, same decisions, same outcomes. We can find ourselves trapped in the land of snap judgments and misconceptions. We've all been on both the giving and receiving end of blind spots. Think about it. Who's talented? Who's able? Who can I trust? Who belongs? We've all been there. Blind spots are part of the human condition. Our choices have consequences for us and the people we interact with. By accepting that blind spots exist, we can stop. Imagine what possibilities exist if we could do it all over again. Different perspectives, inclusive relationships, diverse networks, better outcomes, seeing people for who they really are. People like you, with unlimited potential. We all have blind spots. Once you accept that you have them, you can choose to do something about it. It's time to check your blind spots and focus on what's possible.
Okay, so very interesting video, very powerful in my opinion, about blind spots, which we are going to call by another term used in the culturally competent nursing world as implicit bias. So what you just saw about blind spots is discussing our implicit bias. To determine what this is and how it affects us, we have to determine who we are according to ourselves. What do I call myself? What are the meaningful roles that I play in my life? If I had to go to a job interview and describe myself in 3 words, what would those three words be? May sound silly, but these sorts of exercises that I want you to reflect upon are very important. And they're the first step, cultural competence, and identifying our implicit bias. What is my own cultural identity? How do I identify myself culturally? What is my race, my ethnicity, my religion? But honestly, those words don't tell the whole story. I always get very confounded when I have to choose, am I white or am I Latino? Because I am white, but I live in a Latino family. So I have a cultural identity that has nothing to do with my own race. My husband is Latino. I'm Caucasian. We're a blended family. So there's parts of both identities that are part of me and that I understand. So all these things are very complicated and not straightforward. But what is your ethnicity as you understand it? What is your religion and how does that form your cultural group? How does my cultural identity affect me? And this is where we have to dig down, because this is what's affecting our patients. And this is what's affecting our care. What do I value? What is important? What is offensive to me? I personally, this is just a personal reflection, were I to do this exercise, I personally value independence. I personally value strong women. I personally value having my own voice. When I interact in my nursing practice with cultures who it is very normal for the woman's voice to be spoken by the man for her, I have a very hard time with that, because that butts up against one of my own cultural identity values. That's what I value. My patient may value something completely different. That doesn't mean that I'm right, she's wrong, or vice versa. It just means it's something we have to be aware of. Beautiful quote from Kofi Annan, the former Secretary General of the UN. Tolerance, intercultural dialogue, and respect for diversity are more essential than ever in a world where peoples are becoming more and more closely interconnected. This is the why. This is the why cultural competence is important. However, there's a problem with this quote. And I picked this quote on purpose because, as I told you in the introduction, we all make mistakes. I was talking about a lesson that I had done with my teenage kids. And I said that I wanted to teach them tolerance. One gay friend of mine spoke up and said, I don't want you to just tolerate me. That word's offensive to me. And that was echoed by several other people. And so even though I find myself very culturally aware compared to many of my colleagues, I misspoke. I took a step using a word that I thought would work well that has become a different meaning. It has begun to mean something different to some diverse populations. Be careful with the word tolerance. We need to go beyond tolerance. We need to go to true understanding. Tolerance kind of gives this impression that we're putting up with something. And we don't need to do that. We need to embrace, we need to celebrate. So just a quick little aside. Learn from my mistake. Traditionally, we are taught certain things about culture and healthcare. I remember years and years ago in my Foundations of Nursing class in my undergraduate, we learned about certain races and what happened in their culture and what their culture liked. Did they like hot foods or cold foods? And it was almost like a little blurb in the side of the textbook, like a little box. And that was it. It's not enough. It's absolutely not enough. Not only is it not enough, they're generalizations. I don't want everyone to generalize me by my race. That would be selling me short. And the same is true of your patients. It can lead to stereotypes about cultural groups, their reactions and expectations in the healthcare setting. If we talk about how Asian people always like this, or Hispanic families are always this way, that is not the proper approach. It's us making an attempt to understand a generalization about the culture, but we can't stop there because that's a stereotype. And the truth of the matter is there are statistically significant disparities in disease processes that exist according to race and culture. This is why we can't ignore it. This is why we have to do better, because it affects their health. Okay, so let's practice several scenarios, all right? Maria and her birth experience. You're a labor nurse. Maria comes in to have her fourth baby. You may be thinking to yourself, oh, this is going to be a doozy of a day. The room is going to be full of people. Hispanics have large families. Is that fair to Maria? Is that a stereotype? Or is that addressing Maria's culture? That sort of thinking is a stereotype. Maria may have a big family, but she may not want them there. Another generalization, you have had many Hispanic women give birth with no pain medicine. So you have a built-in assumption, well, Maria probably is going to have a natural childbirth. You can use these experiences to try to delve into Maria's culture, but the only person that can tell you about what her expectations are and what her needs are is Maria herself. We are all members of our culture, but we are all individuals. And we cannot forget that. We can learn broad generalizations about cultures, and those do help. They do help us at least know what questions to ask, but we cannot plan our care based on broad generalizations and stereotypes. You have to communicate with the patient. Qua brings his child to the pediatrician. Qua is from Vietnam. His child has had an upper respiratory infection and has been coughing and wheezing and having a little fever. You sit the child up. You ask Qua to take the child's t-shirt off, and you're going to listen to the child's lung sounds. And you're shocked to see that the child's back is covered in bright red whelps and marks. And you immediately think, how did the child get these injuries? What is this family doing? You need to learn a little bit about some Asian cultures. Practices called coining. They rub oil. They scrape the skin with a coin. They are helping their children according to their cultural remedies. You have to have a little bit of cultural knowledge to be able to engage with these cultures. You also have to be very careful about snap judgments. You can't judge this family until you ask the questions. You need to ask them appropriately, calmly, but realize that some traditional healing methods may look very different than what you're used to in your own culture. And finally, Tisha and her visit to the general practitioner. Tisha shows up to a general practitioner, and the doctor is not in the house that she normally sees. You are a male nurse and working for a male physician. Tisha gets very upset, decides that she does not want to stay for her appointment, and leaves. Are we going to assume that Tisha is not interested in her care? She's not interested in her health problems. She's not interested in being seen or being compliant. Or are we to assume that perhaps Tisha's religious preferences don't allow her to see a male nurse and a male physician, and that situation made her very uncomfortable? And even talking about it might be uncomfortable. So you see, we have different diverse populations all over the place. They come out of nowhere. We're not prepared for them. We have to be prepared for them. We have to improve our cultural knowledge so that we can communicate better and we can have these cultural encounters that lead us to better cultural competence. Now, this is an incredibly important portion of the presentation. A lot of well-meaning nurses are very interested in equality. You might have heard people say, I treat everybody the same. I don't need cultural competency. I treat everyone equally. This is a big one. I don't see color. I don't care about somebody's sexual orientation. That's their business. Why do I care who they've got in their bedroom? I think people that talk about this, which they're talking about equality, have good intentions. They want to give people the benefit of the doubt. All right? But equality stops short in being what people need. Here's another video.
I've come to think that most people believe that everyone deserves the same opportunity to achieve good health. That we should all have what's necessary to pull ourselves up by our bootstraps. That we should all be given boots that fit. And that's when I learned the difference between equality and equity. See, one ensures everybody gets the same thing, while the other ensures everybody gets the something they need. Take 3 neighborhoods. Each one is situated across from the grocery store. One has no transportation system, and the streets aren't safe at night. One needs a boat to get there, and one is positioned a block away. Equality says, we hand them all boots and tell them to make do. One-size-fits-all solutions for problems that require more than one resolution. But equity, the quality of being fair and impartial, speaks to access. Equity speaks to safety. Equity speaks to transportation. Equity speaks to understanding. Equity speaks to the actual human condition.
Okay, so we just saw a video on equality versus equity in practice. So let's go back to those problematic statements that we saw a little bit earlier. Remember this one? I don't need cultural competency training. I treat everyone equally. All right, after the video, are you more aware? Can we fix this problematic statement? Cultural competency training helps me identify individual needs. This may vary according to their cultural identity and their individual experience within that cultural community. So everyone needs cultural competency training, and treating everyone equally misses the mark. We need to treat everyone equitably. All right, what about this problematic statement? I don't see color. Treat everybody the same. It's an error. A person's racial identity is an integral part of who they are as a person. It's part of their cultural identity. You have to see it. You have to take it into consideration. And it is respected by culturally competent nurses. It may not be the most important part of who they are. It depends on the individual. But to say that you don't see it is saying that you don't see the human being. You don't see the person. We all see color. It's how we react to it that matters. Last problematic statement. Let's go back over this one. I don't care about someone's sexual orientation. That's their business. Some people are very private about their sexual orientation or their gender identity. It's a sensitive topic. Being concerned about that privacy and being respectful of that is incredibly important. However, a person's gender identity and sexual orientation are a part of their social culture. It could put them at increased risk for disparities. It's something you need to talk about carefully, respectfully. Okay. This one's my favorite. Big word. Important word. Because even those of us who are working so hard to do this cultural competency thing right, we mess this one up. Because it's almost impossible to steer yourself away from this. Ethnocentrism. This is evaluating other cultures according to our own culture and standards. Basically, it's saying my culture's the center and all of these other cultures diverge from my center. So my plan is to see how are they different than me? How is this different from my experience? How would my culture handle this? This is ethnocentrism. This is not a good launching pad for culturally competent care. Ethnocentrism sort of paints your own experience as the gold standard. I have a good example of this for you. My family loves to travel. You can see behind me some of the places we've been. We went to Jamaica, took the children. I looked very hard for a resort in Jamaica that was Jamaican owned, not some big American resort, but actually owned by a Jamaican family. And it was very nice. It was beautiful. And some of the reviews were interesting. Many of the people said, there's no air conditioner. How can you be in a Caribbean climate and there's no air conditioner? This is ethnocentrism. From our point of view as an American, having an air conditioner is a basic luxury at a resort, and anything that doesn't have air conditioning is substandard. Perhaps from a Jamaican point of view, when there's a sea breeze and open windows, air conditioning is a luxury that's not necessary, and it could even be considered as wasteful. Which one's right? Ethnocentrism. It's very tough. But if you're aware of it, and you're aware that you need to judge other cultures on a general scale and not on your own personal cultural scale, you have to see that their culture is right for them. That their culture is the culture they were raised in that seems like the guiding star and the gold standard. When you can do that, your cultural competence is going to blossom and increase exponentially because you no longer are judging things by your own perspective as the center. Hope that makes sense. This may be something that you have some questions about. So we will do a Q&A later after everyone's had time to review this on the discussion board. So it will not surprise me if we need to do a little more discussion on this concept. It's a pretty tough one. Okay, this is part 2, disparities related to diversity. And this is the real meat and potatoes. And I have another video.
My grandmother tells a story of hospitals in her day. One of barriers, one of trauma, one of fear. When we are sick, she pulls remedies from a tattered notebook, recipes passed through generations of those misunderstood by the world around them. She ensures this cold, this ache, this fever will break by morning. All we need is this prayer, this herb, this belief that better days are coming. She doesn't speak of bad health. She says with stern eyes, only speak life. A lesson, a warning, and a hope in one. Packaged words birthed from a time when healthcare didn't look like help for us. I feel this chill down my spine when I am ill. When my only option left is a doctor's office or the never-ending maze of a hospital. The fear that there will be assumptions about who I am, that things will be ignored like culture and beliefs, that I won't be heard, that history repeats itself. Fear that these hallways will be the same broken roads instead of bridges to new understanding. I envy those who don't have to sit with crossed fingers hoping. Envy their peace of mind and comfort. All anyone wants is to be understood, to be heard, to be told that help is actually on the way.
All right, how does diversity lead to disparities? What makes it happen? You saw in the video, fear of accessing care. What are they afraid of? They're unfamiliar. I had to get dental care in Brazil last year. It was unfamiliar to me. Made me a little anxious. I had my husband with me. But accessing the healthcare in Brazil, which is excellent, by the way, is completely different ballgame than what I'm familiar with. It threw me off. I can see where someone who also has a language barrier would be very, very fearful. Fear of judgment. This happens a lot in our obese patients. They go to the doctor for one thing and they're terrified that all their doctor is going to harp on is their weight and create that as the central blame for all of their other health problems. So they just don't go. This one appears in several cultures. Fear of diagnosis. The idea that if you don't know what it is, it's not going to get you. Or sharing a diagnosis with the actual patient is taking away their hope. So that is a cultural thing that happens in diverse populations that can lead to a disparity. They're afraid of the diagnosis, so they don't get diagnosed until it's too late. Language barrier. This one's pretty obvious. Receptive and expressive communication. If you can't describe your own problem, if you can't be confident in your communication with your provider, if you're confused, the provider talks fast, provider has an accent, very, very difficult to feel comfortable getting care. You may avoid care and try to treat at home with home remedies. It could be also educational gaps. Even native English speakers, if your doctor is speaking in medical school terminology and you have an 8th grade education, there's a language barrier there. So not only do we have to think about language barriers with actual spoken languages, but education barriers with the gaps in our language. I'm not going to speak to someone with an 8th grade education the same way that I speak to a fellow nurse who I know has a college degree. You have to be able to communicate on the level that the person can understand, or you create a disparity. Different treatment by healthcare workers. This is a real thing. We don't like to think it's a real thing. It is unflattering to our profession. Evidence-based practice shows that care is different across the continuum of diversity. Pain control is a big one. There's a lot of current studies on how Black Americans get less pain medicine for the exact same surgery as white Americans. It's terrifying. Whether or not the doctor is aware, whether or not the nurse is aware, there is implicit bias present that's affecting people. Healthcare workers have it too. No one is immune. We all have to work towards it. Okay, so we're coming towards the end. We're going to try to put it all together now. Okay, here we are, putting it all together. Two major components of this presentation and of this module. First of all, probably the meat and potatoes. We're working a little backwards here, but disparities exist among your diverse patients. If you work to have culturally competent care and improve that communication, it will improve your patient satisfaction, but more importantly, it will encourage access to care among these diverse populations and improve our health outcomes. It is not fair that different colored people in our country have different access to health care and have different outcomes when they do even access health care. It's not fair. It's not just. And it's not what we're about as healthcare providers. The other part is recognizing our own biases. We have to recognize what's going on inside of us to be able to connect with other people. We have to recognize that bias exists. We have to take dramatic steps to see that other cultural beliefs are equally as important as ours, and that improves our cultural competence. So addressing that ethnocentrism that is so difficult, and really thinking about who am I? What makes me tick? What starting point am I going out into the world with when it comes to culture? So that is the beginning steps to this journey to cultural competency in nursing. It also is a beginning step to cultural competency in your life, with your friends, with strangers in the community. It's so important. Our world is diverse, and we need to be able to fully engage with everyone and make everyone feel like they're a part of it. So this concludes this module. If you have questions, here is my contact information. We will be doing a discussion breakdown of any questions that you guys have, and we can go back over some high points, and I can give you some more tips and tricks. There are several more YouTube videos for you to access during your course of study. And then there is one other thing that I really want you to take very seriously. You have a minimum of 2 implicit bias tests to take online. This is a free test online, projectimplicit.net. It's a Harvard University study, and it can test your implicit bias for you. Things that you may not even know, or things you think you're really good at not judging, but you're really not. So it's very interesting, and I want you to take at least 2 of the social determinant ones. You take more. The more you know about yourself, the better. But at least 2, we're going to discuss those. If you have questions, please write them down. Please review some of these videos. Go back, replay it. That's the beauty of this asynchronous type of lesson. But I've really enjoyed sharing these thoughts with you. I hope that it's helpful, and I hope that it will change your practice going forward and make you a more culturally competent nurse. Good luck.